Hello, Scott Moore with Moore EMS Consulting, the AAA's HR and Operations Consultant. Just wanted to record a quick video because I'm getting still tons and tons of questions from EMS leaders and fire departments around the country related to the various mandatory vaccination requirements. So just earlier this week, the Safer Federal Workforce Task Force released guidance related to the federal contract employee regulations, which will be forthcoming. As issued by the executive orders from President Biden earlier in September, which will require all federal contract employees to be vaccinated. What we know now is a little more information on how that will play out. Under this guidance, of course, all federal contractor employees, or those, what are they calling, covered employees, will be required to get vaccinated for COVID-19. So that includes all full or part-time employees of a covered contractor who are working on or in connection with a covered contract or working at a covered contractor workplace. In the guidance, they further define a covered contractor workplace to be those locations that are controlled by a covered contractor at which any employee of a covered contractor is working or on or in connection with covered work, contract work, and is likely to be present during the period of performance of that contract work. And that includes those workplaces for EMS employers, such as ambulance stations, say dispatch centers, education centers, etc. So one of the things that we learned from this most recent guidance is what will be, or how will an employer verify, or how will an employer be required to verify the employee's vaccination status. And so under the guidance, they suggest that any one of the following will be acceptable: a copy of the immunization record from the employee's healthcare provider or a pharmacy, copy of that COVID-19 vaccination record card, the one that most people had from the CDC, a copy of the medical records documenting that vaccination for that employee, copy of immunization records from any public health or state immunization information system. Many states around the country have an immunization record system, or copy of any other official document verifying the vaccination with information that includes what vaccine, so the vaccine name, the date of administration, and the name of the healthcare professional or clinic site where that vaccine was administered. Now, they did say in this guidance that they would permit digital copies. So, for example, a PDF or a photograph of these records. The one thing they did identify, though, were that a signed attestation by the employee would not be sufficient. So just the employee swearing that, in fact, they got vaccinated will not be sufficient to meet this guidance. In addition to that, what was included in this guidance were masking and physical distance requirements for those, because there was a provision in the guidance for individuals who have a religious and accepted a religious exemption or medical exemption. So as is currently under the guidance, the recommendations of the CDC are that all employees are masked at all times within the workplace, but that any unvaccinated employee is masked 100% of the time while in the workplace. In addition, in this guidance, they did provide that, in fact, employees should be masked at all times indoors, but then also in certain outdoor settings, and they delineate what those outdoor settings are. In addition, what's required, and this is already required under some of the OSHA guidance, they mandate that there be essentially what is a COVID safety compliance coordinator. So somebody who's in charge to make sure that the federal contractor is abiding by the rules. Finally, one of the things that they included in this guidance was essentially some language that said this federal rule supersedes any other state or local rule that may be contrary to this. So if you live in a state where there are prohibitions on mask mandates, just to be clear, if you're a federal contractor, you have to, these rules will supersede any of those local rules. One of the other pieces of guidance that was released this week was by the Office of Civil Rights for Health and Human Services. Now, as we know, that's the entity that's responsible for enforcing the HIPAA regulations. And what I've heard multiple times over the last few weeks are that employers are concerned that if they release the vaccination status to, say, for example, any healthcare facility that they're working with who is requesting that information, that they're violating HIPAA. Now, it's important for EMS employers to know that they are, in fact, a HIPAA-covered entity as it relates to the patients that they transport. But the privacy rule does not apply, the HIPAA privacy rule does not apply to your own employees as it relates to their vaccination status. All right, so under the guidance, what they said was that the privacy rule does not apply when an individual is asked about their vaccination status by a school, an employer, a store, restaurant, entertainment venue, or another individual. When they're asked about from another individual, their doctor or service provider, about whether they're vaccinated, and or asked a company such as a home health agency where workforce members are vaccinated. Now, one of the other things that they included in this guidance were that the privacy rule does not prohibit a covered entity or a business associate from requiring or requesting each workforce member to provide documentation of their COVID-19, or, and they included other vaccination to their current or prospective employer, requiring that workforce member to sign a HIPAA authorization for covered healthcare provider to disclose the workforce member COVID-19 or other vaccination record to their employer, to wear a face mask while in the employer's facility, on the employer's property, or in the normal course of performing their duties at another location. And then lastly, to disclose whether they have received the COVID-19 vaccine in response to queries from current or prospective patients. So I have several home health clients who have asked just this question. Their patients or their customers have said, I only want somebody in my home who has been vaccinated. And so there have been questions as to whether they can disclose that home health care entity or that individual's vaccination status. And the answer is that they absolutely can. So we're still waiting for some more guidance. Of course, we have not seen the guidance from CMS or the regulations that will be coming from CMS relative to certain healthcare certified facilities. What we do know, and what we believe we know at this stage, is that only those CMS healthcare facilities that follow the conditions of participation. So that is actually not EMS providers if you are a Part B provider. If you're a Part A provider, your hospital will likely be subject to those conditions of participation, which then will mean when those regulations are released that you're required to abide by those regulations. The other thing that we haven't seen yet, and I checked just before recording this, is that OSHA has not released their guidance yet relative to the 100 or more rule. And we're anticipating that will come down sometime in the next week or so. And of course, as we do, we will make sure to keep you informed. But just wanted to get out a little bit of information as when it becomes available. This stuff is coming. It's like drinking out of a fire hose these past few, actually now 20 months. It has been a lot to try and digest, and a lot for EMS providers who are on the front lines and those leaders who are just trying to keep their lips above the waterline and continue to be able to provide the service and take care of their own staff. So if you have any questions, don't hesitate to send an email into hello@ambulance.org. Certainly one of the staff or consultants will be sure to get back to you and answer that question. And with that, I thank you for all the work that you're doing and hope that you have a great weekend.